So let us discuss about the treatment options which are available for migraine. So the topic of discussion is focused specifically on the treatment of migraine. So first let us discuss about some of the introductory points related to this. So migraine headaches are characterized by a throbbing kind of a pain. The pain characteristic is like throbbing kind of a pain that can last anywhere, that is from like 4 hours to 3 days. 4 hours to 3 days. And another important point to be noted here, that the pain associated with the migraines is unilateral. So pain is unilateral. Okay, the pain is unilateral. And the third most important point to be focused here is aura. So aura is a unique feature that is experienced in approximately 25% of cases, right? So these are the important points what you need to know about the symptomatology of migraine. Now let us directly jump towards the treatment options here. And these treatment options can be discussed under following headings. The first will be preventive measures or prophylaxis treatment for the migraine. So let us write it as like preventive treatment. Preventive treatment. Okay. So for most of the episodic migraine, for most of the episodic migraine, meaning less than or equal to 14 headaches, less than or equal to 14 headaches or headache days per month. Okay, for most of the patients with episodic migraines who's having approximately less than or equal to 14 headache days per month, then the initial treatment initial treatment will be as follows. Let me write some of the important drugs here, initial agents. The first one will be initial treatment is recommended with amitriptyline, and second one is the venlafaxine. Second one is venlafaxine, and we'll also give one beta blocker. The beta blocker may be metoprolol or propranolol. Metoprolol or propranolol, and we can give topiramate. Can give topiramate, and majority of the cases the propranolol beta blocker is used when compared to metoprolol here. So here if you concentrate on what are these drugs actually, amitriptyline is a antidepressant medication, right, which is a tricyclic antidepressant. Okay, it is a tricyclic antidepressant. It is primarily used to treat cyclic vomiting syndrome, major depressive disorder, and also it is used in variety of pain syndromes from neuropathic pain to fibromyalgia to migraine and also tension headaches. So therefore amitriptyline can be used for preventive treatment of migraine. And second one is the venlafaxine. Venlafaxine is also an antidepressant medication, but it belongs to the serotonin norepinephrine reuptake inhibitor class. So, serotonin norepinephrine reuptake inhibitor. Serotonin norepinephrine reuptake inhibitor class. And venlafaxine is also used to treat major depressive disorder, generalized anxiety disorder, panic disorder, and social anxiety disorder. And it may also be used in chronic pain. The example may be this migraine. And we know about the beta blocker. And coming towards the topiramate is actually a carbonic anhydrase inhibitor. It is a carbonic anhydrase inhibitor. It is actually used to treat epilepsy and also prevent migraines. So, all these are the drugs which are used as the initial treatment of choice, we can say. And also, one of the very important points we need to discuss about other drugs here. Let me talk about CGRP antagonists here. CGRP antagonist. CGRP antagonist, which is also called as calcitonin gene related peptide antagonist. These are the reasonable options for the patients with marked disability from frequent migraine who do not respond or cannot tolerate to other options, and because of its role in mediating trigeminal pain transmission and neurogenic inflammation. So, mainly CGRP antagonists act on mediating trigeminal pain transmission and neurogenic inflammation. Okay, so these are the drugs, and the best examples will be rimegepant and atogepant. Okay, rimegepant and atogepant. So these are orally formulated drugs, guys. Okay, so remember a very important point that these gpants have also shown benefit for migraine prevention, not only in like mediating trigeminal pain transmission and neurogenic inflammation, and these are very very important that it shows benefit for migraine prevention. And if you see a kind of analogy over here, let us discuss about when these drugs were approved by United States Food and Drug Administration, that is FDA. FDA approved the monoclonal antibody CGRP antagonists. What are they? They belong to the class of monoclonal antibody, CGRP antagonist. So the drugs which are present are, the first one is irinumab, and the second one is fremanezumab, fremanezumab, and the third drug under this category is galcanezumab. Galcanezumab. Okay, so these drugs were approved by the FDA in 2018, and another drug which is the fourth one, so eptinezumab, which is approved in 2020, and the gpants, for example here, rimegepant, rimegepant, and another drug is the autogepant. So these are approved in 2021 for migraine prevention. So remember all these drugs which are approved by the FDA, which are the monoclonal antibody CGRP antagonists. Okay, and nowadays, majority of the cases we are using eptinezumab. So therefore, and also remegipant. So it is very important for us to know about the route of administration as well as the dosage for these drugs here. So let us concentrate here. The first one will be eptinezumab. Okay, eptinezumab. So eptinezumab is given via IV infusion. IV infusion over approximately 30 minutes for every 3 months. That is, the dose will be 100 milligrams. Okay, 100 milligrams given as an IV infusion, approximately over 30 minutes for every 3 months. Very, very important to remember, guys. Given in the form of IV, 100 milligrams is the dosage, is given over 30 minutes for every 3 months, guys. So, eptinezumab. Now, let us discuss about another drug here, which is the rimegepant. Rimegepant. So, rimegepant is actually a small molecule CGRP receptor antagonist which is administered orally and also effective for the migraine prevention. Okay, so this is what we need to know about the treatment options which are available for the prevention of the migraine. Okay, so now let us discuss about what are the drugs actually we are using for the patients with mild to moderate migraine attacks. So my heading here will be mild to moderate. Mild to moderate migraine attacks. Okay. So for the patients with moderate or mild to moderate migraine attacks, which are not patients not associated with vomiting or severe nausea, not associated vomiting or severe nausea. So the initial treatment is recommended actually initiated initiated the treatment with simple analgesics. Example may be non-steroidal anti-inflammatory drug, which is aspirin, right? So rather than the migraine specific agents, so non-steroidal anti-inflammatory drugs, aspirin is most often used for the patients with the mild to moderate attacks. Okay. Now coming back towards moderate to severe migraine attacks. Moderate to severe. For the patients with moderate to severe migraine attacks, the treatment should be done with triptans or the combination of sumatriptan with naproxen. So for moderate to severe attacks, the treatment should be done with triptans. The most common triptan which is used is sumatriptan. And most often, sumatriptan will be combined with the naproxen. Okay, naproxen rather than other migraine specific agents. So what are these triptans? These triptans are the family of serotonin receptor agonists, which are commonly used in the actually acute migraine attacks, acute migraine, okay, acute migraine attacks. And out of this, I already mentioned that sumatriptan is most often used, and it is the agonist of the 5-hydroxytryptamine 1B and 1D. So I can write it as 5-hydroxytryptamine, okay, 1B, 1D. It belongs to this particular class. So it acts on this receptor. So what these triptans will do is, especially the sumatriptan, by binding to these receptor, they causes cerebral vasoconstriction, because the cerebral vasodilation is the actual culprit for the development of the migraine. So what it will do is, by doing so, by acting on these receptors, the action is going to be cerebral vasoconstriction, cerebral vasoconstriction. And another most important action will be, it inhibits trigeminal nerve activation, inhibits trigeminal nerve activation, inhibits trigeminal nerve activation, and also preventing the release of vasoactive peptide, prevents release of vasoactive peptide. Okay, so this is the main action: induces cerebral vasoconstriction, it inhibits the trigeminal nerve activation, and also prevents the release of vasoactive peptide. And these agents are rapidly as well as effectively abort, or we can say decrease, headache intensity in around 70% of the cases. So even though it is most effective, we have certain side effects which are associated with the triptans. Let me write side effects here. So the important side effects are going to be increase in the blood pressure, increase in the BP, there will be dizziness, there will be dizziness, there will be malaise, okay? And remember that it is contraindicated in, okay? It is contraindicated in hypertension because it increases BP, right? Contraindicated in hypertension, contraindicated in coronary artery disease, and also contraindicated in pregnancy. Important to remember, guys. So this is what we need to know about the drugs which are used with moderate to severe migraine attacks. Now, our final heading will be, what are the treatment options which are available for the patients with severe migraine attacks, especially in the emergency department. So severe migraine, especially in the emergency department. Okay, let's study about this. So for patients with refractory migraine attacks who presents to hospital emergency department, generally the initial treatment is given either subcutaneous sumatriptan or a parenteral antiemetic agent rather than other migraine specific drugs. So my treatment option over here will be subcutaneous sumatriptan, subcutaneous sumatriptan, or a parenteral antiemetic agent. Okay, this can be given, and especially when you are trying to give the parenteral antiemetic agent, or when giving intravenous metoclopramide or chlorperazine for migraine, It is important to use diphenhydramine, especially to prevent akathisia and other dystonic reactions. So that is what is actually recommended. So let me give some of the important points over here. When giving when giving IV metoclopramide, IV metoclopramide or chlorperazine for migraine, it is important to use diphenhydramine, diphenhydramine. It is important to use diphenhydramine, especially for what? Diphenhydramine to prevent to prevent akathisia, to prevent akathisia and dystonic reactions. Dystonic reactions. Okay. So this is what is very very important for us to understand about the treatment options which are available for the severe migraine. So by this we have completed all the drugs or agents which are required for the treatment of migraine. Thank you so much.